Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, founder and chief medical officer of Atlantic Coast Aesthetics. And Dr. Pane, this question came in from Facebook. Their question is from West Palm Beach, and they're curious about a plastic surgery consultation. So it looks like this will be the first time for them visiting a plastic surgeon. They'll be turning 40 soon. She's had 2 kids and will be considering a mommy makeover. And they're a little nervous about coming for a consultation. Dr. Payne, what should they expect, for your first visit, and maybe some advice on kind of what to ask and how it works?
Yeah, that's good. One of the things with what's happened with the society recently, we are into essentially the digital revolution. So information is available to people that has really been more difficult to find, even what we're doing now, for example. So a lot of times people will do a lot of research on what they're interested in before they even have a consultation. Websites have a lot of information. There's a lot of material that can be learned about. So I would just suggest getting the information together and what you're looking to do. And then in terms of researching plastic surgeon, a lot of times that comes from recommendations from a friend. There are online recommendations. It's difficult to make sense of all that material. Once you choose somebody, then what I usually like people to do is, it's one thing to focus on a specific procedure or something like that, but it's actually better to just tell the person what it is you don't like, and then see what they say in terms of what can be done. And in that way, you're not focusing on a specific service or type of procedure, because that may not work in all people. One of the downsides of all the information that's available is being able to make sense of it and pick and choose what is appropriate or not appropriate in certain circumstances. And that's where the expertise of the consult, the person giving you the consult, the surgeon, is going to come into play. They can help you make sense of what you've learned, read about, pictures, and so forth, and go from there. Naturally, it's important the person has good credentials and a good track record of doing these surgeries safely and effectively. And all of that you get from meeting the person, learning about them, and then the online reviews, recommendations of friends, family. So essentially, that's a good summary of how to go about the consultation. It's important to keep in mind it's also a medical evaluation, so the person should be focusing on your background health. Make sure that you are healthy, because in general, cosmetic plastic surgery is primarily for people that don't have any real ongoing active medical problems or problems that are well controlled. Because then this is not it's not life-saving surgery. It's not things that we're doing when someone's injured or have an accident or something like that. It's for essentially elective. So that's important to keep in mind as well.
Well, thank you, Dr. Payne. And if you have a question for the doctor, please visit our Facebook page and ask away, or website. And Dr. Payne, we appreciate your time, and we'll see you next week on the next question.
Great.